What is the difference between an MD and a DO? Let's do a brief overview. MD granting institutions are called allopathic medical schools, while DOs attend osteopathic medical schools. As of January 2024, there are 158 accredited MD programs and 37 accredited DO programs in the United States. The application requirements for MD and DO programs are virtually the same, with both osteopathic and allopathic programs using a holistic admissions review and weighing grade point average and MCAT scores heavily. In both types of programs, the general curricular structure is similar, with students typically spending much of their first 12 to 24 months in the classroom and the majority of their training beyond that in a clinical setting. Now let's highlight some differences. During the 2023-24 academic year, for matriculants in MD programs, the average MCAT was 511 and the average GPA was 3.77. In looking at similar data for DO matriculants, the average MCAT was 504 and the average GPA was 3.61. One unique aspect of osteopathic education is the 200 hours of training in osteopathic manipulative treatment, or OMT, defined by the AOA as a set of techniques used by doctors of osteopathic medicine to diagnose, treat, and prevent illness and injury. Using OMT, a DO moves a patient's muscles and joints using techniques including stretching, gentle pressure, and resistance. Those skills typically mean an added curricular focus in training on the musculoskeletal system. If you think you may be interested in applying to DO schools, I have two pieces of advice. Number one, shadow a DO. Number two, work to establish a professional relationship with a DO to cultivate a strong letter of recommendation. DO schools want to know that you're applying to their programs because you've invested time into researching their scope of practice and you are truly interested in practicing osteopathic medicine. Finally, let's talk about residency match rates. MD and DO residency programs merged in 2020, meaning everyone is competing for the same residency spots. In 2023, the NRMP residency match results reflect the PGY1 match rate for US MD seniors was 93.7%, while the match rate for US DO seniors was 91.6%. While both MD and DO seniors matched into the primary care specialties, family med, internal med, and pediatrics at high rates, DO seniors faced more difficulty matching into highly competitive specialties. For example, when looking at students who matched into their preferred specialty, MD seniors matched into thoracic surgery residencies at a rate of 83.7%, while DO seniors matched at a 2% rate. In neurological surgery, the difference was even greater, 86.8% for MD seniors and just 1.2% for DO seniors. I hope you found this information helpful as you think about if you plan to apply to MD, DO, or both types of programs.